Sudden infant death. SIDS. U.S. versus Sudden infant death. What is sudden infant death syndrome? Sometimes when a baby is sleeping and it looks healthy, they're actually dead, and it's what we call the sudden infant death syndrome. These things can happen, and it's no one's fault, even if the baby is in the hands of a caregiver or parent. It can happen even if you're doing things right after even learning how to care for an infant. SIDS is rare and is a common cause of death for babies between 1 and 12 months of age. Most babies could die of this between the ages of 2 and 4 months. What is the cause of SIDS? It is quite unknown to most medical professionals. It will most likely occur in premature and low birth weight babies. It can be seen often when soon to be mothers did not get proper medical care during pregnancy or mothers under the age of 20. When babies sleep on their bellies, they may not breathe well. Side sleeping was considered okay at one point, but it's become a hazard because by putting them on their side, they will most likely roll onto their bellies quite easily and could give them breathing trouble. Signs and symptoms. There are no signs or symptoms, not even any warning signs. Babies that die from SIDS could seem healthy even after putting them to sleep. There are usually no signs of any struggle, and babies are often in the same position as when they were placed in the bed before they sleep. SIDS is named the cause of death when no other causes are found. To find out why a baby dies from SIDS, an autopsy is performed. Medical experts will review babies and parents' medical history and study the area where the baby died. A full body x ray and a CT scan is included in the protocol, as well as a microbiological examination of the body fluids, a lung tissue and tox screen report. The death scene is examined by the police in case of possible crime activity. US versus Scandinavia. There isn't really much of a difference as Scandinavia only just has a lower SIDS rate than the US. And Sweden has a very low SIDS rate going by 0.14 per 1,000 live babies. And US, about 2,300 babies in the United States die of SIDS each year. And some are more at risk than others. For example, SIDS is more likely to affect a baby who is between 1 and 4 months old. It is more common in boys and girls, and most deaths occur during the fall, winter, and early spring. Reducing the risks of SIDS. The most important thing you can do is to always place your baby to sleep on his or her back rather on their stomach or side. It's best not to smoke. For the first 6 months, let the baby sleep in a crib, cradle, or bassinet in the same room as you sleep. It's considered a safe arrangement for safer sleep than sharing a bed. Bed sharing should be discussed with a healthcare provider. Stopping the use of alcohol and other drugs would be a big help too. If one is using alcohol, legal drugs, or medication that can cause heavy sleep, especially when bed sharing, it can be a risk and should always be avoided. Reducing the risk of SIDS continued. Never sleep with a baby on an armchair. The safest place for a baby is in a crib, cradle, or bassinet. Keep an eye on the baby while traveling and take the baby out of the car seat when you've reached your destination. Keeping certain items like stuffed animals, blankets, or anything that could trap or suffocate the baby, remove it. Dress a baby in a sleeper instead of using a blanket. Treatment. There is no known treatment or cure for SIDS. The only thing to do is just reduce the possible risks. But after losing a child to SIDS, Families can find ways to cope from it, including joining a grief support group, getting professional help from a counselor, psychiatrist, or psychologist. Talking to close friends and relatives could help instead of bottling it up. Conclusion: it doesn't matter what state, country, or continent you live in, SIDS comes out of nowhere. Hopefully, in the future, there will be some way to know or detect this and prevent it from happening. The only thing a person can do is just keep an eye on their kid, just checking on them every now and then, and to remember that you're not alone and you're not the only one who's worrying if your child will wake up the next day. And here are my sources. The end.